coming from the discussions din ni Francesca kanina, I'd like to throw the first question to Garett and ask, ano ba, Garett, yung mga common misconceptions? Because you talk to clients a lot. Of course, you're a health and accident champion for Sun Life. So, ano yung mga common misconceptions when it comes to health insurance?
Siguro ang usual na mga misconceptions when it comes to health insurance. Number one, ano siya, very expensive. Like, very few people lang yung pwedeng maka-afford ng health insurance. So, nabanggit niya kanina ni Francesca na marami tayong range of product in Sun Life. So, that would also differ from from the budget of the client. So, may mga particular na product na babagayan yung particular na budget ni client. So, marami, like, dun sa research na nabanggit ni Francesca kanina, nakalagay doon 68% daw ng mga Filipinos walang insurance, mainly because of that misconception about its premium or yung price that we pay for the health insurance policy. And many of us, we don't know yung actual na premium niya kasi natatakot tayong kumausap ng advisor. Diba? So parang from the onset pala medyo ini-ignore na natin sila and whatnot. Pero pagka in-engage pala natin sila, makikita pala natin na meron pala namang mga products that actually cater to our specific needs and our specific budget.
Alam mo, sa segunda ako doon kasi yung product na dinidiscuss ni Francesca kanina sa Life Assure, I have that as well. And I was so surprised kasi yung binabayaran ko doon monthly was only about 500 pesos. Mga ganun lang siya. So, for 500 pesos, yung coverage ko for that, if I remember correctly, is 500,000 already. So, if anything happens to me, covered ako for critical illnesses, for just a small amount. So, yung peace of mind that it brings to me, especially as a mom, na hindi naman mahihirapan yung family ko, if that happens, malaking bagay na for that amount. Diba? Akala natin kasi like limpak-limpak. Well, meron ganung products. Pero hindi lang yun ang meron. So, on that note, ano ba yung mga insights nyo, Garett and Francesca, kung bakit hindi kumukuha? Aside from that misconception, ano pa yung ibang reasons kung bakit nag-aalangan yung mga tao na kumuha ng insurance?
So let me start with, ngayon, lalo na po ngayon, because we're at the post-pandemic stage, grabe po talaga yung revenge travel. So in short, it's really prioritizing the budget. So naiiba yung priorities versus sa paniniwala nga nila na kailangan nila ng health insurance. Pero ngayon, nare-reallocate na ang budget na yun. Or sabihin nila, or we want that, pero ay, may lakad pala kami mamaya. Bukas, long weekend, pupunta pala kami, let's say, ng Bohol. So gagamitin ko muna yung pera na yun for that, and then makakaligtaan na. So it's really on the prioritizing of the budget.
Siguro sa akin naman on the other side, kasi yung kay Francesca, very true naman yun. Pero that's for people who can actually afford to get health insurance, diba? So in our country, alam naman natin, very challenging din ang finances. So for some, even if they actually want to get health insurance, they understand the need to get health insurance, medyo mahirap. Kasi maraming mas immediate na need, diba? So, doon papasok ngayon yung proper financial planning, diba? Baka naman, pwede natin makita, ilista natin yung mga expenses, baka lang na may pwede pa palang i-allocate for insurance and get the most basic muna for the meantime, diba? Pero yun, yung iba talaga, lack of the budget yung concern. Or yung iba naman, parang they feel like hindi naman nila kailangan. Diba? Parang gano'n.
So yun yung pumapasok. Gusto ko yung sinabi mo, Garett, about yung lack of financial planning. Kasi minsan yun yung first step na mahirap sa atin, di ba? To sit down and actually list ano ba yung mga pinagkakagastusan, ano yung mga pinupuntahan ng pera natin. Kasi minsan, oh my God, for me personally, hindi ko alam kung magkano na ginagastos ko sa Grab food delivery. Sa araw-araw na ginawa, parang feeling ko, nag-i-invest na ako sa kanila. Pero when it comes, exactly. Pero when it comes to financial planning, ano ba yung, kumbaga something very basic na tip, Garett, on how they can go about it? Ano yung mabibigay mo pwedeng simulan in a practical way?
Ang pinaka-basic siguro when it comes to financial planning, alam na natin itong lahat, pero siguro struggle tayo in implementation, just budgeting. Diba? Alam naman natin lahat na important ang pag-budget. Tama po ba? Yes, diba? But ilan dito ang talagang nakakapag-budget? Or kung meron kayong budget, you actually follow the budget. Diba? So, it's easier said than done. But if you really want to fix our finances, we have to go back to the basics, which is budgeting.
Sige na nga. Masama yung loob. Si Garett naman eh. Oo nga.
Fake talaga yung mga advisor.
Oo. Well, yan naman kaya kami advisor. Yun yung value ng advisor na merong nagpapaalala sa'yo. Kasi di ba parang kung tayo lang yan. It's so easy to be lax about it, but an advisor can help you stay on track and remind you, okay, eto yung goals mo, always go back to your goals, this is how we're gonna do it, how we're gonna pivot if kailangan. Pero I'm sure, Garett, throughout your, how many years have you been an advisor?
6 years po.
6 years na. Okay, so throughout those 6 years, meron ka na bang mga na-experience na success stories in terms of a health claim?
Relatively, no, 6 years pa lang ako dito. And yung mga clients ko, majority of them are millennials and Gen Zs. And thankfully, wala pa naman sa kanilang nagkaroon ng major critical illness. But I do have successful claims when it comes to hospitalization. Yung mga na-confine lang because of various diseases. Meron na-confine because of COVID, meron na-confine because of an accident. So kapag kami mga ganyang clients, they are confined, we are able to get or claim hospital income benefit, what we call them. So depende yun kung gaano katagal na-confine si client. So we're able to claim and nakatulong din yun sa pag-settle nila ng hospital bills nila.
That's so nice. Diba? You really feel your money working for you pagka ganun eh. Pero meron ba tayong insights, Francesca, on when it comes to health insurance or maybe insurance in general, mas marami na ba ngayon ang kumukuha ng millennials and Gen Zs?
Actually, yes. You would be amazed with how, siguro, a lot of it, hindi ko alam, part na ba siya ng school curriculum, ang financial planning, but really, you would be proud and you would be amazed by how young or yung segment ngayon na talagang bumibili at nag-i-invest para sa sarili nila ng health insurance are on the younger side. So siguro yung mga batch ni Garett, those millennials and Gen Zs are really looking into purchasing a plan for themselves.
Ay, mga kapwa ko Gen X, tayo pahuli. Huwag tayo pahuli, mga Gen X. Oh my God, step up tayo. Keep up tayo sa mga younger generation. Especially now, I guess, growing up in the digital age, no? Kasi the information is very much accessible to them. So maraming nakakaano kaagad na, mali yung interpretation ko pala nito, ito pala yung tamang information. Garett, sa community mo sa Facebook, ano yung mga common concerns that they bring up?
When it comes to insurance po to.
Yes.
When it comes to insurance, siguro ang pinaka-main concern is what specific product do I get? Kasi there are a lot of options when it comes to insurance, like life insurance, health insurance. Ang dami. Even, pwede mo pang i-breakdown niya yan. So, yun yung pinaka-concern nila. If I'm going to put up money for this, which, di ba, hirap kita ng pera, you would want to maximize your hard-earned money. I would want to get something that is actually beneficial to me. So, doon pumapasok, ano bang product yung maganda para sa akin? And, eto, hindi siya pwedeng sagutin lang ng very general kasi it differs from person to person eh. Kaya it's always best, sobrang cliche niya na, pero it's always best to consult with your financial advisor kasi your financial advisor will help you figure out what specific product will be beneficial for you and what will be sustainable for you. Kasi hindi lang pwedeng makatulong lang, kailangan syempre pasok din sa budget mo and makompleto mo siya.
I like that word, sustainable. Kasi kailangan talaga dire-diretso siya. And yun nga, isa pang misconception, di ba, is that you think one product is enough. But Francesca is saying kanina na marami siyang products. Yes, you have something to say
If I
on
may
that.
add also, so I started, na ang alam ko, ang mga kabataan or at mga kabatch ko, tayo lahat, we don't want to approach a financial advisor. So ang gagawin natin, pupunta tayo ng Facebook, TikTok, Twitter, Reddit, i-google natin yung lahat, but not one person has the same experience or same financial status as the other. So, pwedeng ilagay ko doon na, ako, itong age ako, ito yung mga goals ko. Meron siguro akong kapareho, pero in terms of financial status, baka hindi kami pareho. So, it's still really best. So, tama si Garett, might be cliche. Huwag po kayong matakot to approach them. Pero guys, hindi po kayo niyan kakagatin. Hindi niya po kayo i-charge ng kahit ano. He will present a very good financial advice for all of you. Depende sa situation niyo. Kasi di ba, we are also have our own life milestones. You might be getting married, baka naman meron po kayong anak on the way. That would change things for you. So really, it's best to consult or at least ask for advice from your financial advisor. Siguro po may mga kakilala na kayong financial advisor. Please do approach them. Mababait po yun, hindi po yun mangangagat.
Pero pagka mag-a-approach ng financial advisor, what are the questions that they should be asking? Like, di ba, how do they start that conversation? What can they expect when they sit down with an advisor?
So, pag may advisor na po kayo, kontakin niyo. Pag wala po ako na lang. What you should be asking a financial advisor? Well, siguro para sa akin, anong dapat mong tinatanong sa isang advisor is, number one, well, dapat yung advisor actually magtatanong sa'yo eh. No, your advisor will ask you different things about you. Mainly, yung mga factors that affect your finances para makapag-recommend ng maganda si financial advisor. So, siguro for example, yung mga expenses natin, yung cash flow natin, yung goals natin, no? Primarily, ano yung mga financial goals that we want to achieve. Kasi from those questions, the advisor can now give you sound financial advice. So, pagka walang ganong process, medyo mahirap. Diba? So, para sa akin, yun yung essence sa pagiging advisor eh. The advisor should be asking the proper questions to the clients and not just, parang selling products parang right away.
Related to that actually, yung question ni Mommy Sigrid on Zoom, sabi niya, how can you detect naman if ang financial advisor is just offering something to make a sale? Sorry po, let's face it, kasi meron po talagang ganon. Garett?
Una-una, hindi po ako yun. Yun nga po, ganun yung magiging procedure. We call that in Sun Life, we call that financial needs analysis. So we do that to examine the financial status of the client. So what we want to do is create a roadmap for the client. So for us to be able to do that, we ask the clients, ano ba yung mga financial goals mo clients? What do you want to achieve in 5, 10, or even longer? So alam na natin yung gustong puntahan ni client. And then we assess the current finances of the client. So that would be point A. So now, the role of the advisor is to provide solution kay client that would bridge the gap between point B and point A. So ganun po yung tamang process of getting a financial plan or an insurance product. So hindi pwede yung parang nakita lang kayo tapos ayan na, pero makalagaan, bayad ka na. Yan. Pagka po ganun, siguro yun yung sale lang ang
Pwedeng red flag siya, no? At saka totoo yun, kasi parang sa amin, sa Sun Life, we try to really embed that in their mindset na partner for life ang role nyo. So, when you say partner, that means establishing that rapport and chemistry between client and advisor. So, kayo din, like, if you feel like it's not working out with this advisor, don't force yourself to push through with it. Find another advisor kasi for sure marami iba pa dyan na you will be comfortable with kasi diba, our finances, it's a very personal subject for all of us. Napaka-personal niya, kaya hindi natin siya, of course, ipapagkatiwala sa kahit sino lang. So you find that partner that you can have rapport with, you can have chemistry with, and you can really trust for years to come. Okay. So, kanina, Garett, ibabato ko ulit sa iyo yung tanong kasi si Francesca nakapagkwento na about her health journey. So let me ask you naman, at what point in your life did you realize na, ay teka, kailangan ko pala na i-prioritize yung health ko?
Okay. Ako, fairly healthy naman ako, I would say. Medyo nawala lang siya sa routine ko nung nagkaroon ako ng baby. May mga parents ko ba dito? So parang naguluhan na ako sa buhay ko. naguluhan na ako sa buhay ko nung dumating si baby. So parang very different na siya eh. Ang daming adjustment na nangyari. So parang for a while, the health part yung parang kung paano yung mga gagawin ko, parang mga self-care activities, nawala siya for a while. So parang naisang tabi siya. So parang after a while, nararamdaman ko na yung effect niya sa akin. No? Physically at the very least, like madali na ako mapagod. Tapos, siguro madali akong ma-stress din. So parang, parang hindi na rin ako makaisip ng maayos. So parang doon ko na-realize, okay, I need to para get back on track. At the same time, naisip ko, yung baby, kakapanganak pala ng baby ko, syempre, I want to live longer. Diba? At the very least, para dun sa baby ko, para may kasama siya. So from that, nagsistart na ako ulit mag-gym na ulit, kumain ulit ng tama. So ayoko naman din. Ako, I'm fairly covered, no? I would say na konti na lang naman yung gap dun sa healthcare na kailangan ko. Pero ayoko pang magamit po yun.
Of course, oo, totoo naman. Now, we're down to the last question. Cheska, I'd like to ask you, ikaw, growing up, you said you were really very fit and very healthy. But for that kind of a person, bakit kailangan pa rin ng insurance?
Okay, so lagi ko rin natatanong sa akin, and I really believe is that we don't know what's going to happen next. There are a lot of uncertainties. In fact, dito lang sa building na to, or I am exposed to friends who are the same, who are fit, who have been exposed to the same environment siguro sa akin, but would be diagnosed with a certain critical illness. And I'm talking about the big C or cancer. So it was shocking, and this is the reality for all of us. Magugulat na lang tayo na yung katabi natin can be diagnosed, not you, or yung mga yung katabi kong term, yung mga nakakasalamuha natin would be diagnosed with something grave, when in fact, kakakita mo lang sa kanila, hindi pa nagpa-party-party lang tayo. In fact, hindi pa nagkakabike lang natin, kakabalik nga lang natin eh. We've heard of nightmare stories like this, and it can literally happen to us. So, doon ako naniniwala. And siguro din, because I'm predisposed, I have this predisposition of having cancer. I have a cancer gene in my line. So, yun. And at the same time, yun nga, the reality is, uncertainty can really strike. Uncertainty is everywhere, and a grave illness can really strike you, even if you're very healthy.
Thank you so much for that, Cheska. Garett, I'd like to ask you, if there are no questions at least, but of course, Garett and Cheska will be staying in case you'd like to engage them a bit more. But just some closing words on how people can unlock their health goals in the context of insurance and financial security.
Alright. Sige, siguro to add na rin dun sa minention ni Cheska kanina. Parang ang daming uncertainties, and that is one of the reasons why we have to get health insurance. Kasi, syempre, we have different life milestones, di ba? Like, we want to travel, we want to have our own businesses, we want to have our own houses, our cars. But you have to realize, guys, when we save up for these things, and then yung mga uncertainties na to mangyari, we won't be able to get those things that we want. Di ba? Kakainin na siya nung sa healthcare. And siguro, lang din, para may, parang contrary, no, dun sa sinabi. Di ba, uncertainties nga yun. Alam niyo ba guys, na 9 out of 10 reason kung bakit namamatay yung isang tao is because of an illness. So parang it's certain that way, diba? Na majority of the time, we will get sick first before we die. So, ang pangit man niya pakinggan, ang morbid man niya, but this is something that we have to prepare for if we want to achieve yung mga life milestones that we want, yung mga dreams, yung mga goals natin. We want to protect those. We're not just protecting yung health, yung ating finances, we're actually protecting yung ating mga goals, yung ating mga dreams for ourselves and for our family.
Thank you so much, Garett. Guys, a round of applause naman please for Garett and Cheska. Thank you so much for engaging us in our Fireside chat.
Please share, like and click to subscribe to megabites.com.ph.